Good morning all. Today we are going to discuss an important topic in implant industry, which is biological aspect of an implant. What are the science behind the surfaces of implant and how does that interact with our body? So before going to the topic proper, I would like to discuss about one particular metal which has changed the dimension or the phase of the orthopedic surgery as well as the replacement of a missing tooth, which is titanium. Ever since Brannemark has discovered the application of implant with an accidental discovery, he was basically an anatomist who was researching into the blood vessels, and when he tried to remove an implanted titanium from a rabbit bone, he could not do that because it is tightly bonded to the bone. He termed this as an osteointegration. So what makes this quality of this titanium? So before going into the topic, I would like to discuss certain good qualities of titanium. Titanium is of a molecular weight 22, and when we compare the strength to the weight ratio, the titanium possesses more strength when compared with the other material, and it is of light weight. The strength of the titanium can be compared with the stainless steel, and even it is 4 times more than the stainless steel. But weight, when you compare the same quantity of weight, it is of very less weight. This metal do possess another good quality. It can be reshaped or milled and produce, can be converted to any shape. So metallurgically, when you think titanium, it possesses a lot of good qualities. Another good quality possessed by titanium is its bio-inertness. For example, when you implant a titanium inside the bone, it will get integrated to the bone without producing any immunological reaction. So because of this quality of titanium, it has been widely used in orthopedic surgery as well as in implant industry. I would say that after 1980s, it has changed the dimension or the course of orthopedic surgery as well as the dental prosthetic rehabilitation. Yet another good quality of titanium is its low modulus of elasticity. What do you mean by modulus of elasticity? See, when a titanium is being implanted inside the bone, the titanium is comparable. The modulus of elasticity of titanium is comparable with the modulus of elasticity of the bone. But when we compare other metals, the other metals all possess high modulus of elasticity. So because of this comparable modulus of elasticity, titanium can be safely used inside the bone. Yet another quality of titanium is the bio-inertness. Well, now we have 4 grades of titanium. We have grade 1, grade 2, grade 3 and grade 4 titanium. So depending upon the grades of titanium, the strength of the titanium implant also varies. Say for example, grade 1 is 4 times stronger than the stainless steel. Grade 2 is 2 times stronger than the stainless steel. 3 and 4 is much lesser than, the strength is much lesser than stainless steel. And what is commercially pure titanium? We'll always come across this terminology in implant industry. There are a lot of manufacturers of implant which they will mesmerize with these terminologies, and they will claim their implant system to be the best. You should understand what exactly commercially pure titanium is. Commercially pure titanium is of a purity 99.75 percentage. If it is more than 99.75, percentage purity, it is said to be commercially pure titanium. Now, not only the purest form of titanium is being used in implant industry, they have mixed titanium with other metal also and proved to be best, have better strength than or better qualities than the regular titanium. Say for example, titanium, aluminum, palladium in the ratio T6, titanium 6, aluminum 4 and vanadium. This combination of titanium alloy is being used in implant industry. So when it be used in this proportion, it is said to have more strength than a commercially pure titanium. And there are a lot of other advantages also for this alloy. So only two types of titanium is used, only one commercially pure titanium is being used, as well as we have an alloy of titanium is also being used in implant industry. Well, now we understood that different good qualities of titanium. In late 90s, what happened is they want to improvise this, the quality of implant, the strength of implant. So they have done little biomodification on this implant. They have tried spraying titanium over the implant. We have a core of implant and titanium is plasma sprayed over the implant, which has improved the strength of an implant or the retention of implant 600 times. So we can use a shorter implant when there is anatomical limitations like a nerve or a blood vessels which is closely placed. So many researchers has changed in this dimension and they have done a lot of biomodification. Another biomodification is like an hydroxyapatite cotton as a particulated graft. A component of a graft is being sprayed on a titanium core and they have tried using that. So a lot of additive process has happened on the implant surface, and also they have tried a lot of subtractive process. Say for example, they tried to etch the implant by acid etching, like with a sulfuric acid, nitric acid and hydrochloric acid. So acid etching produces a roughened surface, which again will have a good bond to implant interface, and that bonding will be strong. And another method they have been used is sandblasting, a forceful jet of alumina, that is the aluminum oxide has been sprayed over an implant. The particle size of an alumina is of 250 microns, and when it is bombarded on an implant surface, it will create a small depression on the soft metal and of a size say 2 to 3 microns. So an osteoblast can easily go into this implant, roughened implant surface, go attach and form a contact, bond formation of that implant surface. So this type of implant surface is called a subtractive implant therapy, where you have etched the implant and they sandblasted the implant, so it improves the surface of an implant. So there are a lot of manufacturers who produce these type of implant. Say for example, Straumann has a particular, they have patented one technology called SLA. Like they have used sandblasted, which stands for S. They used a large grid, and A for anodization. Anodization is yet another improvisation on the surface of implant, where the implant surface is being anodized and a layer of titanium dioxide thickness will be increased. Generally for a normal implant which is machine milled will have a thickness of or anodization or thickness of titanium dioxide as 20 nanometers only. It can be increase into 100, 200 and 400 nanometer thickness, which will have a good bond to implant interaction, and the implant, such implant will be strongly bonded and it will be more bio-inert in nature. So these all are the qualities which improvise on the lateral aspect of implant because of the advent of new research. Well, now we understood the qualities of an implant and its surface modification. Now let us see how this implant is being get attached to the bone. What is the real essence of osteointegration? Imagine we have prepared an osteotomy site. We have drilled in a cavity and we are about to place an implant in it. Now, immediately after the implant or the osteotomy preparation, there are a lot of biomolecules which come into the site of this socket, which is being prepared for implant placement. There are two different types of biomolecules. One is smaller biomolecules, which comprises of ions and water molecules. And you have larger biomolecules like the proteoglycans, glycoproteins, cells, and different cell type like platelets, macrophages, and various erythrocyte cells which has come into play. Now let us see how this biomolecule is getting interacted with the implant surface. Immediately when you place the implant, the redox potential over the surface tension over the implant surface is less, and the redox potential is reduced because of various forces like van der Waals force, covalent bonds, and electrostatic force. These biomolecule will get attracted and it will go bind on the raw implant surface. So this is the first bond which is being bonded between the raw implant surface and the biomolecules of our body. Then eventually what happens is there will be a blood clot formation by the fibrin network which is being produced, and the platelet will get entangled in it and there will be a clot formation. Well, now the sequence of events from day 1 to day 10 is like this. It is called an inflammatory phase of an implant placement. Immediately after the osteotomy preparation, there will be a lot of biomolecule will be coming into the site of osteotomy preparation. As I said, macro and micro molecules will come and act, plays a pivotal role in the first phase of implant placement. The implant is being covered by a pellicle with these molecules. Immediately after it is being covered with this molecule, the clot is being formed. There will be a fibrin network which is being formed, and the platelet will get entangled and there will be a clot formation. So immediately after the clot formation, the platelets release the growth factors and cytokines. Once the growth factors and cytokines release, it will induce the non-specific immunity, and it also, as a next step, it induces specific cell-mediated immunity. So the sequence of event from day 1 to day 10 is like an inflammatory phase. The patient may feel little bit of discomfort and pain during the initial phase of this therapy. Then the second phase is proliferative phase. Well, now from day 10 to 28 days, it is called proliferative phase. There will be new blood vessels which is being formed inside the bone. From the tuberculation, new blood vessels will start forming and it progress towards the implant. There will be new connective tissue formation. The osteoblast from the pluripotent cells or mesenchymal cell will proliferate into the surface of implant. And this phase is called proliferative phase. Next phase of implant therapy is maturative phase. From 28 days to 42 days, it is called an initial phase of maturation. Well, the third phase of the healing is maturative phase. Initially, the bone which has been formed is a woven bone which is having very soft in nature, or the collagen will be arranged parallel in nature. Then this collagen will eventually replace and remodel and forms very strong lamellar design of bone. Woven bone is soft in nature, it cannot withstand the force of an occlusal load, and slowly as the time progresses from 28 days to 48 days and furthermore also, it will change, the nature of the bone will change to a lamellar design, and there will be more canaliculi which is coming inside, and the bone will remodel itself, and finally it will form a strong bone around the implant. So for maxilla, it takes 4 to 6 months to form a strong bone over the implant, and for mandible, it takes 3 to 4 months to form the bone around the implant. So this is the minimum period we should delay to load the implant. Once the bone is strong around the implant, we can load the implant with prosthesis. Well, now we understood various qualities of titanium, various surface modifications of titanium, how this titanium is getting interacted with the body fluids, what are the different stages of the proliferation and maturation. So with this basic understanding, let us move on to the theory class on precisely how this titanium dioxide is formed and how this titanium oxide is incorporated into the bone, and what is the reason for this bio-inertness or biocompatibility, and let us learn more regarding osteointegration in this upcoming theory class. So I welcome all of you to this theory class. So with this I conclude. Thank you.